Bipolar disorder can manifest itself initially as depression, mania, or hypomania. If the first episode is depressive, the individual may receive that diagnosis for years until their first manic or hypomanic episode, at which point their diagnosis would change to either bipolar 1 or bipolar 2. However, there are certain signs that suggest that the depression may actually be bipolar disorder, even if the individual has not yet received that diagnosis. It is important to correctly diagnose bipolar disorder, as the treatment differs from that of unipolar depression. Here are 5 signs, based on the Diagnostic Manual and the Bipolarity Index by Dr. Gary Sachs, that an individual may be on the bipolar spectrum. The first depressive episode occurs before the age of 20. In bipolar disorder, the average age of onset is between ages 15 and 20, whereas with unipolar depression, it tends to be between 30 to 40. Antidepressants do not improve symptoms, and in some cases, may even worsen them. Antidepressants are more likely to cause mixed states, where the individual may become anxious or agitated. This may be an indication that bipolar disorder is becoming more evident. There is a family history of bipolar disorder, particularly in a first-degree relative such as a parent or child. The individual experiences 3 or more depressive episodes within a 5-year time span. Bipolar disorder tends to be cyclical and recurring, with a typical course of a depressive episode followed by mania or hypomania, and then followed by another depressive episode, which can occur months or even years apart. The individual experiences full recovery within 1 month of taking a mood stabilizer. While this is not an absolute indicator of bipolar disorder, it is a suggestion that the individual may have the illness. It is important for individuals to recognize these signs, as the treatment for bipolar disorder is different from that of unipolar depression. Some individuals may do worse with antidepressants, particularly if they have bipolar disorder. Treatment for bipolar disorder may involve the use of mood stabilizers in addition to or instead of antidepressants.